I bet that you've gone online to look for shoulder exercises, either after a shoulder injury, after a really tough golf or tennis match where you've got aches, whether you've had a chronic injury, if you've had breast cancer surgery, all those reasons where you can have tightness in the shoulder and you're looking for relief. So you've gone online and you've Googled and you've seen wand exercises. W-A-N-D. Yes, wand, as in a magic wand exercise. But that's not what they mean. When we talk about a wand exercise, what we're really talking about is either passive assistive or active assistive range of motion. The reason we want to do passive assistive exercise is because you're going to find a limitation. It may be right at the beginning, right after surgery, right after an injury, where you don't have a lot of movement, let's say in shoulder flexion, because that's what we're going to demonstrate today is shoulder flexion. But this passive assistive can be for anything. So if we talk about shoulder flexion and we talk about limited range of motion, it could be right after surgery where you've got limited range, or it could be a chronic issue where you are going out to play tennis or golf and you're finding that there's limitation with that end range of motion. Or you're finishing up with a round of golf and you've got a lot of aches and pains because you've overdone it. So I want to see you using this passive assistive to get to that end range and right after surgery, of course, once you're cleared by your surgeon. So why this works so well? Here's a little magic. Here's the trick. Is because you're actually relaxing the muscles while it's moving. If I actively move my arm, I have to use muscles to move it. Muscles contract, they tighten, and then you get to a certain point where it starts to hurt. And those muscles tighten even more, and you don't get a nice flow of range of motion. So when we assist the arm, and that is with the one that's not injured, or let's say the opposite for me, you are letting those muscles relax as it goes through the range of motion that's comfortable. So you can get more movement, decrease the swelling that can be in there, you can get the joint moving much better in there, and alleviate your symptoms faster, get the range of motion back, then you can get on to stability and strengthening exercises. Because that's what you want to do. You want to level up, always starting with mobility. So even if it's chronic, even if it's a long-term issue, the reason it may not be healing is because you're doing too much strengthening and you didn't start where you should, which is with mobility. So I want you to take a step back. I want you to get into this passive assistive movement and really get that joint moving. But one of the things I don't want you to do, and you're going to see this online, and that's why I mentioned Google, is just going into full range of motion. So if we look at these clips, let me talk you through what you may see and exactly what I want you to do. Now, this is probably how you're used to seeing passive assistive shoulder flexion. So I want you to take a look. I'm just going to start this. And let's stop it here. Because what I want you to see is that one arm is coming out, so is the other, and it looks like both are working. So this is something that you're really going to have to work on, is that one arm is doing the work, the other is just holding on for mobility. And that's why starting like this can be a problem. The dowel is here to help you out, and it's the same way if we just take a look. Same thing if you're doing it supine or in a lying down position, is that this dowel is going right overhead and fantastic stretch through the shoulders here. That dowel, again, is helping the one arm move better because the muscles can relax, and that's what we're looking at here. So the one arm is doing the work, the other is along for the ride. But again, this can really put you at risk if you're not ready for this type of wand exercise. So let's go through and I'm going to show you exactly what I would like you to do to start with. Here is the first step. We are going to stop right here. We're going to take a look. The dowel, again, nice and straight. It's between the two hands. They're holding on. But what I want to show you here is this flexion is at 0. There's no movement in the shoulder right now. Fantastic place to start. We've got the wrists aligned in a nice neutral position. The elbow is flexed. So this is where we want to start, where it's a lot easier to bring this up and to push this right through just like a chest press. We've now got 90 degrees here for shoulder flexion, but we started with 0 and we worked our way up by moving both the elbow and the shoulder. So it took a lot of strain off that joint as we're moving through. And I'll just show you here, bringing this back down, again, nice and slow, right back down to the bottom. And again, you see, we're back to 0 here for the shoulder. The elbows are in a good position. The wrists are neutral. So it's way less strain on the shoulder for 2 things. Number 1, right after surgery. And again, this could be recovery from breast cancer surgery. This could be recovery from rotator cuff surgery or shoulder surgery. And it can also be if you're hitting that tight spot below 90 degrees, if you've got frozen shoulder, I'd love you to do this and start with this part of the wand exercise. So as you saw in the video, start slowly. Start with the assistive chest press. So when you do that movement, we are starting right down at 0, no shoulder flexion. And then as you push forward with the help of the other arm, you're getting all the way to 90 degrees. Then, when that's comfortable, when you know that the wrist has good movement, the elbow has good movement, then bring on that other movement. What I would love for you to do is try out this exercise. Let me know how it's working for you, and let me know if you're finding that you can get those end ranges that you really need, or it's helping you get through post-surgery and getting that range back so you can move on to stability and to strengthening. Send me an email to info@marionbarnick.com and please hit the subscribe button. I would love for you to see Monday Moves with Marion as soon as it comes out each week, and allow me to travel on with you through your journey for health and productivity. Have an awesome day.